Okay, we're gonna call this meeting of the Health and Human Services and Veterans Standing Committee to order. Okay, I don't want to hear myself echoing. All right, we'll start with the Pledge of Allegiance. And yes, I don't see Don C. Bonsby. Okay. Stephanie, do you guys want to listen to that?
Oh, sure.
Thank you.
I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Yeah. Wasn't either.
Well, that was.
Has that one? Or is it one?
Oh. Yeah.
All right, can I have a motion to approve our 19-point agenda?
So moved. Second.
Move in a second. All those in favor, please say aye.
Aye.
Any opposed? All right, hopefully y'all had a chance to look over the previous meeting minutes. Any corrections or comments? Not, we'll declare those approved and move on to number 6, which is public comment. Is there anyone here from the public who wishes to speak? Hello, Linda.
I wrote you.
Yes, you did.
Okay.
Supervisor Gentis is here to speak.
I'll try to be very quick. I know you guys have a lot of work to do. I'm sort of cleaning off my desk and checking out my list. So you're on it. And ever since I was on this committee, which I highly, you can pass some of these down. And also the county board, felt that the state legislature just was not paying their due. And that we were getting more and more with the placements and the amount of money we had to pay for that. And the whole thing just didn't seem fair to me. That there was something wrong about the whole system. So I'm just making this suggestion and you can do what you want with it. But I had talked about this a year ago, I think with Teresa, and then Tricia, recently you mentioned that you had Medicaid or something that might premiums, which will help a lot, which is good. But in the meantime, I just giving you this little push because my feeling is that there should be a formula per capita for every county. So like a small county, when we hit that certain number compared to others, the state should come in and take over part of it. Because it's not fair to a county of 18,000 if all at once we have 5 placements for another month. We cannot appropriately budget for that. So I know John Hockemer mentioned something about not lobbying with our local representatives, but I went recently to the Mark Line listening session, and this is one of the things, I had 2 things this is one of the things, and Mark Line replied, which he doesn't usually talk to those, and he said, yeah, this is a state problem. And so he seemed to listen to that. So I'm just encouraging you, because you've got your handle on it. I haven't had my handle on this for a while, because it's been a couple of years since I've been on here. And I gave you some numbers. I actually don't have Tony Kurt's home address, but I find that he always replies to me in phone calls when I mail a letter to his home address, but I should have found it for you. Anyway, I just am here today to try to explain to you of an option I think you can maybe think about, that you as a group who know this better than I do, might want to reach out. And I think as a supervisor, they listen to you because they know that you know what's really happening. So that's it today. Thank you.
Thank you. Is there anyone else, maybe online, that wishes to speak? Okay. Now that will take us to number 7. The BSO budget summary is shared here or online. See online. Okay. Well, we did have her packet and her budget in our packet. So I don't know if there was any questions from anyone. Can I send those to her? Okay. We also have her admin report, but we'll skip that as well. So that will take us to our consent items, which are numbers 9 through 12. Stephanie, do you have anything you wanted to share on any of that, the budget?
Let's see, expenditures, vouchers, you'll notice I put it in long ways this time, so it's a little easier to read.
Yes, thank you. I did notice.
The only thing you'll probably notice about this one is a lot of, still 23, 24. So we
Right.
still got a lot of that, overlapping yet. We're really winding down on those 2023 expenditures, so knock on wood, which kind of segues into the budget summary for 2023, same kind of thing. So, right now, if you can scroll down to the slide. No, nothing to, super notable, the usual stuff in there. But in the budget itself for 2023, it's still not final. I'm not gonna say this is like a final report. Just because there are still some 2023 expenditures trickling in, very few left. I'm pretty confident very few of those left. But we still have quite a bit of anticipated revenue that we haven't gotten yet, right? So I still need to do final claiming for some of the programs and things like that. So, but right now, our core budget balance does look healthy. So at this point, I don't anticipate any huge fluctuation there. So I just wanted to point that out. And as far as the placements, since we were just talking about placements, I think overall, I think we're gonna end up slightly over. As you can see, we're at 1.4 million. On that, I'm pretty confident that these are final. I'm not gonna say final, but we'll probably finalize those next month for sure. But yeah, they're pretty, it's not gonna change much. And the other thing I included in there was revenue I'm anticipating getting in from our final Spark claiming. So there's usually a little bit of money left over. Spark is our DCF. It's where all our DCF allocations are. So there's a little bit left in there that I can put into the placement, the children's placement fund. So hoping that'll bring that closer to zero, but it's still gonna be over. So, but like Linda said, it's so hard. We thought we were gonna be good because we had one age out, but mid-year we had another one that we ended up having some trouble with, so.
So things we've been implementing in the department is having at least quarterly placement meetings. So we have one for the adult and one for the children. The other thing we did for our institutional, like our Winnebago placements, Brandy and I sat down and met and really did a deep dive into, you know, where were they chaptered from? How long were they there? What can we do differently? One of the things we did notice is a large amount were coming from about a third of our Winnebago placement days were out of the jail. And so we had a meeting with the jail administrator, the sheriff, and the chief deputy to really sit down and talk about, here's where we're at. And we have a plan now to have better communication before somebody is chaptered out of the jail, and having communication with the administration here and the administration over there. Because really that is a safe environment, and there should be rare times that somebody needs to have to go from the jail to Winnebago. So those are just things that we are working on and looking at and trying to make improvements for this year's budget. We're also hopeful though that Medicaid will start covering some of the IMD placements that was passed through and sent to HHS or DHS, excuse me, that they need to be looking into it and making that request to the federal government to be able to start billing some of those expenses to Medicaid, which would be a huge help.
Do you remind me, what did we budget then for placements for this year?
The
Did we change it? Okay, so I know initially when we had looked at that, we were going to decrease, but it's. the
No, we
same.
did not. No,
Okay,
same.
all right. Any other questions on those? I think we do probably want to go over. Sorry, my iPad is struggling today. Number 12, behavioral health unit, structural changes.
So what we have in our behavioral health unit right now is there are 16 employees 10 programs, 8 grants, and that's one that there's often different grant opportunities with the state. We have one manager for the full unit, and then we have a supervisor that supervises Children's Long-Term Support Program and the Birth to 3 program. We're looking, and Candace and I have had discussions about this, and what we would like to do is modify that supervisor's job description to be the behavioral health manager supervisor and not just those 2 programs. There would be no budgetary impact for her to transition, for us to modify her job description. As we still have it funded in our budget, and a lot of that would be through the CCS program or CLTS program, which is pass-through funds. And we get reimbursement from Medicaid for those programs. It would, with doing this, it would also lead us to need to fill a service facilitator position, because currently she has a full caseload. And so we would be looking to, on our staff authorization table, there is one leased service facilitator position that we haven't filled, and we would be looking to fill that position. And that position would be, like, we would bill Medicaid and they would reimburse us for that worker's time. So there would be 0 county levy in that position. These are things that Candace and I have talked about through the way our handbook and our policy and procedures. It is something that she can approve, all of these things, but I wanted to make sure that you guys were aware and you guys were comfortable with these changes that we're looking to make.
Is this something that would require a motion?
It would not.
Okay.
No. I mean, if you guys came and said, no, we don't want you to do that, we wouldn't do that. But we really want to make sure you guys are aware.
Do that.
So the individual in the role right now is excellent. If that individual ever left, is this a manageable load for someone coming in new?
With the new position as the behavioral health supervisor, I think so. Yes, the person who is in there does a phenomenal job. She really wants to continue to do some case management, and we've really talked with her about, yes, as long as there's the bandwidth for you to do it. So it might be one of those that she has the bandwidth to do it, but the new person doesn't. We don't have it built in there that they would have a case. I think we have it in there that they would help to oversee some of that. So yes, this person could, the next person, I'm not exactly sure. Maybe, maybe not. But the way the job description is set up, it would be something that could be manageable, I think, with the right experience.
Thank you.
The long answer.
Good question. Anyone else? All right, well, I think this is great. I know the unit themselves came up with this, so everybody seems on board, so I'm looking forward to that helping.
Thank you.
Okay, let's move to number 15. Sorry, my iPad. I know I'm blaming it, but it really is being difficult. Okay, number 13. This will be an action item, approving HHS contracts, agreements, and amendments.
So the first one we have is amendment to the 2024 contract we already have in place for Hanson Assessment and Educational Services. We are requesting an additional $5,000 to their original $16,000 contract to provide supervision and education to the staff in the Child and Youth Services Unit.
So if I may speak a little bit on that. The manager of our Children and Youth Services has decided to take one of the open case manager positions, so we don't have a manager in that unit right now. Melanie Hansen has been doing CPS work for Vernon County for, I believe, 23 years now, and has agreed to modify her contract to be able to provide some education, supervision, and support for that unit through this transition. This would be county levy that would fund. These dollars would be county levy, but we don't have a manager in the place right now, so we are able to absorb it in our budget.
All right, if there aren't any questions, we'll need a motion for that.
I'll move.
I'll second.
Any further discussion? All those in favor, please say aye.
Aye.
Opposed? And I do see Sherry's online. Welcome, Sherry. Okay, so then the next one would be the Hidden Springs.
Thank you.
Hidden Springs Clinic is a new contract for us in 2024. We are requesting $9,500 to Hidden Springs Clinic to provide therapeutic contact between child and parent for families being served by the Child and Youth Services Unit.
This is specifically for one family. The judge has ordered us to work on a reunification plan between a parent and a child. And so after looking long and hard, this is somebody who is willing and able to provide that service.
This fits within our budget that we approved for this season?
It'll be tight. No, we don't currently have anything like that budgeted, but we are court ordered to provide this.
I'd have to look at the details of the budget, see what kind of line it might fall in.
There's no reimbursement for this?
There would be zero reimbursement.
In a situation like this, does the state or anyone else provide money when a judge gives us an order to do this kind of thing? I mean, it seems to me that if they require us to do something, there should be compensation somewhere along the lines. Is this a possibility?
They give us a base contract every year that we are allowed to use to provide these services. So they do provide that. How the children's budget is set up, there's very little set up for providing services. It's really about looking for outside funding sources to provide those services. My hope is that we can get our placements down, that some of the placement funds could be built into that budget to be able to provide some of these preventative or reunification services.
Is that something over time, from year to year, if you use more of that money, that they would increase your budget, or is this?
No,
They're just kind of
yeah,
coughing the ones in their pockets.
yeah.
I report out total expenses
Yeah.
and replacement funds to DCF every year. Well, every year, I've done this a whole 3 years, but but I mean, so they know the numbers and they haven't increased our allocations, so.
It seems
you know,
like
I
we're
think we
between
get
a
those
rock
funds.
and a hard place. I would make the motion to go ahead with it.
But yeah.
Second,
Any further discussion?
that's what Linda wants us to do, is exactly what you're talking about.
All right, all those in favor, please say aye.
I,
Any opposed? Okay, number 14, approve new transportation coordinating committee member.
So we would ask that you approve adding Jeremy Welsh to our transportation coordinating committee.
I did have a question. So it says he's filling the vacant transportation providers proprietary PBM. What does PBM stand?
I gotta say.
Is it Pine Valley?
Oh.
Yep, so it's usually, sorry, this is Roxanne. So usually it is either a Schmidt-Woodland Hills or a Pine Valley Manor. Actually should be Community Village, so that's how it's stated on the listing that we have across with the county listing. So that's why it's in there as that, but it is always a Schmidt-Woodland Hills member. We do lease vehicles to Schmidt-Woodland Hills, so we make sure that they are a part of that committee. And then we also always have a member from the Pine Valley from their board as well. So.
Great. Any questions? Otherwise, we need a motion to approve this.
Moved.
Motion by Mr. Tagacha.
a second.
Cindy, did you second?
City.
Okay. Any further discussion? All those in favor?
I,
Right.
Any opposed? Okay, number 15 is approve new comprehensive community services coordination committee membership list.
So the committee is all the same except Jessica Brown. They had that's a staff member from Passages, and they had some staff changes, and she is the one replacing Marissa Banker, who actually came and works for us now. So Jessica Brown will be taking that place, and we'll be adding her.
All right,
So
sounds good. Thank you, Mr. Gashel. Do I have a second?
do that one.
Thank you, Mr. Van Landen. All right, all those in favor, please say aye.
I,
Any opposed? Okay, number 16, our Public Health 140 review. Hi. Yeah. Thank you, Brandy.
So for those online, this is Brandy Anderson, Public Health Officer, Public Health Manager. I'm notifying you that we are in need of a formal review by the DHS 140 committee from our state. This is a required formal review process that occurs for all local health departments every 5 years. Our last formal review occurred in 2016. We had an abbreviated review that happened in 2021, and that was somewhat of a placeholder type review, for lack of a better term, due to that pandemic response. So DHS staff reached out to me and other health departments that are in need of this review. And so they identified we're one of those health departments that we have to have this occur. And we gave them 3 dates, and we are up now for March to have our review occur. My staff are aware, and they've been reviewing the possible 140 questions. We've been meeting with the Office of Practice and Policy Alignment Consultant. His name is Joe Larson with DHS, and he's actually come on site to help us. He recognizes that we are a bit of a newly restructured unit, and wanted to assure us that this is not a punitive process. It's more to help us. The state has changed it greatly to make it less so that they can help health departments. Just to recognize that they're meeting the required services, identify strengths and areas of improvement or areas that we might need help with.
Opportunities for growth.
Opportunities. We have all the necessary documents in place. Some of the necessary documents in place are already have been submitted. That's kind of some pre-work. It's like our copy of our CHA, our CHIP, annual report. And then they just needed like documentation that we have, regularly occurring board meetings. So if you have any questions, I'm open to answering those right now.
What level of health department are we?
We're a level 2 health department, and that's the level that we'll be seeking to move forward with.
So they don't necessarily go over all those questions in that document that you sent, correct?
Not necessarily. So my understanding is some of those questions and areas, there are overlying or overlapping themes throughout the discussion. It's more of a type of an interview process, they told me. It occurs over 3 hours. They'll ask for my staff to speak, talk about our services, what those look like. And again, sometimes our services overlap in some areas, so they explain they may not feel it's necessary to ask about every single area.
So in their 2021 review, did they have any deficiencies or problems that?
I'm not aware of that. I was part of that interview session, and it was very brief. It was a very, very short meeting, and I don't recall any areas that were identified to work on at that point, to be honest.
I have a question. Can you bring a follow-up report after this evaluation to this group or no?
I'd be happy to provide some type of, think of the word.
I think we could do it, if the state provides us a written summary, we'll do that, and we'll have Brandy come back to talk about how it went and what are opportunities for growth.
How soon do they get back to you?
Yeah, right.
That's a great question.
I think they try, my understanding is they try to as soon as possible, so that if there are areas of opportunities of growth, that we get working on those right away. I will say that the 140 coordinator and our consultant with DHS and even the public health nursing consultants, they're all very supportive, and I think they really do want to help local health departments continue with their work.
So that is something Ingrid is coming to it. I think if others are interested in coming, they are certainly welcome to. We just have to kind of be mindful of quorum. So if we have quorum, it's going to have to be posted as a public meeting. So please let us know. I would say it's on March 7th. Please let us know by the 29th of this month if you are interested in coming, so that we can post appropriately.
Okay. Thank you, Brandy. Takes us to our admin report. Director comments?
Yeah, so I did submit the report in the folder. A couple of things I just want to highlight. We do have an opening in our ADRC. Our DBS went to become the EBS, so we do have an opening for DBS there. In our mental health unit, they just added an AODA counselor from the children's unit. So we're excited, they're excited to have a full unit once again. One of the therapists has completed a domestic violence training and plans to start doing some groups in the community, so we're looking forward to that. That's something we've talked with probation and parole about, the district attorney's office, and something that they feel could be beneficial to the community. In public health, I just want to know respiratory illnesses are on the rise right now, including COVID, influenza, and RSV. So really just encouraging people, if they are sick, to stay home. In our economic support unit, they are back to doing some overtime. This is part of the unwinding funds that we have received. And so those are all funded by ARPA funds. And then, as I said earlier, in our children and youth services, Jessica decided to take a case manager position, and so the unit manager position is open. I'm hoping to have that posted by the end of the month. We are having some individuals come in and help support the unit, and Brittany Ward's the supervisors also taking on some of those duties. And then we have a new worker starting on Monday. So outside of the manager position, that unit is fully staffed as of Monday. And then the last thing that I just want to, I guess, do a shout out to all the staff. There were 84 contracts that were created for 2024. And so that's a lot of work, a lot of time. I think the majority of them are back. So I just want to thank the managers, Jamie, some of the supervisors who helped get everything together and turned in. So it's a lot of work, and I appreciate the work they did.
Great. I agree. Thank you, guys. Awesome job. Well, another short meeting. Does anyone have things they would like to see on the future agenda? I know you mentioned bringing back a summary of the public health report, which, as Dr. Barris pointed out, that we don't know how long the state will take for that. But yeah, we'll definitely try to do that. Anything else that you guys, yes.
If I may make a brief comment, I want to apologize for coming late. We have an old-fashioned wind-up clock on our wall that we always use. And for some reason, it lost 10 minutes, last evening. So we thought we had plenty of time. So I want to apologize for being late. But then also, I've read all the minutes that we've gone through, and they've been very, very well done. And I think we, as an extension of the county board and the overseers of HHS, I think we ought to express our sincere gratitude for Tricia and all of the people that work within the department. I think it's nice that every once in a while they receive acknowledgement from those, that are kind of over them, that you're doing a good job. I mean, the minutes have been, I've been climbing a park right now at our church, and to put agendas together and to do this is not always an easy job. Many times it is, but I think we appreciate that, what you and all of the staff do. So thank you.
Megan does our minutes and agendas.
Megan.
Yes, Megan.
Thank you.
With
Thank you.
assistance from
I
everybody else.
marvel. Every time I see it, I marvel at the Kristen, it's there. So thank you. I'm done.
Thank you, Lee. Great. Further agenda items, then that will adjourn us to get my calendar. March 14th. Sound right? Okay. May I have a motion?
No, it should be the second Thursday.
It's the 14th.
It is, yeah, it's a long,
Sorry.
Yep.
no, it is weird. Okay. I have a motion to adjourn us to the 14th of March. Right, Mrs. Ticker? Second, Mr. Van Landijk. All right, all those in favor, please say aye.
Aye.
Aye. Opposed? We are adjourned. Thank you, guys.